Hello, today I'm going to talk to you about the link vitamin D has to Crohn's and ulcerative colitis and how it can help. Now, the aim of my study deals with the fact that there is no officially established vitamin D level set to treat specifically inflammatory bowel diseases, unlike bone disease, which I will delve more into later. Which begs the question if the vitamin D level is different than the conventional standards, and if it is, what is the vitamin D level that can help improve IBD symptoms? So my hypothesis is that if somebody's serum vitamin D level is over 45 nanograms per milliliter, it will have a significantly better effect on alleviating symptoms of IBD and decreasing activity and flare-ups, as opposed to the conventional standards of 30 nanograms per milliliter. Then, of course, the null hypothesis states that there would be no difference between the two. A little bit about the inflammatory diseases is there's two main kinds. One of them is called Crohn's Disease. Basically, it's intermittent flare-ups which alternate with remission, and they can afflict any part of the GI tract, as you can see here, anywhere in the large intestine and the small intestine. Ulcerative colitis is continual inflammation, however, it only affects the large intestine. Regardless, both conditions have a lot of similar symptoms which are stressful to have. Abdominal cramps and pain, diarrhea, blood in the stool, possible ulcers and fissures, which came from constipation. In worst cases, it leads to bowel obstruction and possibly colon cancer. As you can imagine, the emotional impact of having these conditions is pretty significant because it really affects the ability to enjoy life, because when bowel patterns are erratic and painful, it can really just be disabling. And just the anxiety and the distress of not knowing when the next flare-up or diarrhea is going to come from is also very unpleasant. Also, it could lead to anemia and even kidney stones. Not to mention, managing and treating these diseases is also expensive. So, how is vitamin D relevant in regards to Crohn's and ulcerative colitis? Is that a deficiency has actually been linked to higher disease activity of these conditions, which includes increased rates of relapse and poor response to whatever drugs one may be taking. This ultimately lands people in the hospital, sometimes requiring surgery. Scientists' experiments have confirmed that vitamin D supplementation does help decrease relapse rate of Crohn's patients who are in remission. So vitamin D functions, most people are aware that the primary role is to regulate homeostasis of calcium and ultimately affect bone metabolism. Thus, research in terms of vitamin D and establishing sufficiency levels mostly deals with bone disease. So the standards defined by the Endocrine Society are, this is plasma, essentially vitamin D, levels to be under 30 nanograms per milliliter. However, vitamin D is involved in at least 30 other physiological systems based on studies which found vitamin D receptors in many different kinds of tissues that have nothing to do with bones. So specifically, there's many other diseases that vitamin D can prevent and affect, like diabetes, heart disease, depression, cancers, arthritis, multiple sclerosis, even asthma. So there's a lot of research needed there, but this study is going to specifically focus on the inflammatory bowel conditions of Crohn's and ulcerative colitis. And many studies have proven that correcting a deficiency really helps manage these conditions. And also other studies did see that the conventional sufficiency level of 30 nanograms per milliliter has not been enough to prevent certain non-bone diseases. So we're going to see if inflammatory bowel conditions are included in that. So vitamin D levels, specifically in terms of IBD, various studies have found differing information. However, they all seem to agree that 30 nanograms per milliliter is not enough. In one case, Crohn's patients below 35 nanograms per ml had a higher incidence. Another study even found that quality of life continues to increase with levels between 50 and 59. Then a third study found that concentrations above 40 have been associated more with remission in patients. So that being said, it's actually quite surprising that it is not standard practice to measure vitamin D level in patients who have Crohn's and ulcerative colitis. And on top of that, people rarely can meet vitamin D needs through diet because it's mostly meats and dairy and things like that. And sunlight is also not enough for populations that live above a certain latitude. In the winter, they can't even synthesize vitamin D because of the angle of the sun. And in the summer, they still have to come out at very specific times of the day with a certain amount of skin exposed. And most people end up vitamin D deficient, so clearly something's not working, which is why we are going to supplement in this study. So the study is going to have 128 participants, men and women anywhere between 18 to 60 years old. The age cap is just to try to avoid other comorbidities of advancing age. And the disease severity will be mild to moderate. We don't want people who have no symptoms because it's going to be hard to compare. And we don't want people who are too severe because they're probably in the hospital, they may be on TPN, and it's probably be on supplements at that point. Some other exclusion criteria besides severity is other GI diseases that can mask improvement: pregnancy, chronic kidney disease, cardiovascular disease, having an ostomy, and also being on medications that would suppress flare-ups, because that can also affect test results. So there's going to be two different groups. The first is the control, which is going to correspond to conventional vitamin D standards. So they're going to have to be deficient, which is under 20 nanograms per milliliter, and deficient, and the goal will be to get them to 30 nanograms, which is the sufficiency level. The second intervention is going to be the intervention group, and these people will have vitamin D levels between 30 and 39 nanograms per milliliter. Sorry about that. This is sufficient by conventional standards, but may not be enough specifically in terms of inflammatory bowel diseases. And the serum goals for those two are going to be between a minimum of 45 and a maximum of 59 nanograms per milliliter. The supplemental dosage was decided to be 5,000 units a day of D3. We wanted to find a high dosage, but also proven safe. 10,000 was going to be the level, but it runs a risk of hypercalcemia, so we want to minimize the risk of this study. Other studies have used a variety of dosages. 5,000 seems to be commonly used. Some studies have started with 1,000 and found that 5,000 is ideal. 5,000 elevated levels in a particular study from 16 to 45 mean of nanograms per milliliter. 12,000 IU worked, but it kind of dealt with lower levels. From 28 to 38, we want higher levels. Basically, anything higher than in the hundreds is essentially good. Vitamin D is going to be tested via blood draws. Serum 25-OH-D3, which is blood vitamin D, is the main focus. Another quality is C-reactive protein, which tests for inflammatory markers, basically the degree of activity of the disease. And also calcium will be checked just to make sure it's not going too high, because that can indicate toxicity from vitamin D. Symptoms will be collected. There are two different types of questionnaires that are specifically designed for these conditions. One of them is the Crohn's Disease Activity Index, CDAI, and it focuses on how the disease affects the quality of life, which is a reflection of how bad symptoms are. So certain things that are rated as abdominal pain, frequency of diarrhea, just general well-being, and the need for anti-diarrheal drugs. Then there's the SIBDQ, which is the short IBD questionnaire, which is used for both conditions. There's 10 questions that are scored in 4 domains, which includes bowel symptoms, emotional health, systemic functions, and social function. Here is an example of the SIBDQ. You can see the questions it asks is like feeling fatigued. Everything is within the last 2 weeks, which fits our study's design. Basically, delaying, canceling social engagements, how it affects leisure time, feeling depressed because it is a frustrating condition, painful condition to have. And then more specific to symptom questions like gas and maintaining weight and things like that. And these questionnaires will be asked before the start of the study, monthly during the study, and at the end of the study. And the study lasts 4 months. So the ultimate questions that this study seeks to answer are the conventional standards of vitamin D of 30 nanograms per milliliter. This is what the Endocrine Society deems sufficient. Are they enough specifically when it comes to inflammatory bowel diseases? The study, we anticipate that there will be a difference. We hope to reject the null hypothesis that group 2, which will strive for vitamin D levels above 45 nanograms per deciliter, will have more symptom alleviation than group 1. This will mean that 30 nanograms is not high enough to help manage or treat Crohn's and ulcerative colitis, and that a higher serum goal needs to be set when looking at these conditions specifically. So this is a picture of a beach, because if people were here, they would probably get all their vitamin D needs, but since most of us do not live there, we will rely on supplements. And thank you so much for listening to my presentation. I am now here to answer questions, and here are my references. Thank you again, and have a good day.